Okay, in this video, I'm going to demonstrate how to do a newborn assessment. It's really just a pediatric assessment, but this is a 6-month-old boy, so this is a newborn assessment. So first, I would want to do a general environment assessment of that, making sure that the baby's in a safe location, safe spot, reduction of any stimuli, stress, anxiety, make sure to have good communication skills with the parents, kind of watch how they interact as well to make sure that they have a good bonding going on. And then I want to, if it was an older adult, an older child, I would, if restraints were necessary during this assessment, then we would, use those as prescribed. Okay, so general survey. I'm going to check the baby's behavior. I'm going to check the baby, temperament, anxiety, eye contact, how the baby interacts with everybody. I'm going to check the baby's symmetric of their muscle tone, make sure that that it's blinking, that it's doing all of the developmental stages that a 6-month-old would have, which that would be in the general assessment part. And with a 6-month-old in the Erickson's, it would be trust versus mistrust. Okay, so now that I have done that, if it's an older child as well, I would check for like a suicide questionnaire that you would do on the computer. It would prompt you to another screen if it was positive. Just pretty much be easy with the baby so they trust you and they are, better at doing the assessment. Okay, so first I want to do my vitals. Okay, with the vitals, I want to do a pulse ox to get the oxygen. I want to do the temperature. You can do it tympanic, or you can do it on the forehead. You want to check respirations. You just want to lay your hand right here and check the quality of the respirations, make sure they're not having any trouble, shortness of breath, breathing problems. And then you also want to listen for a minute. Okay. So then after I listen for a minute, or 30 seconds times 2, I want to listen to the apical pulse for 1 minute. Make sure there's no heart murmurs, that everything's even. Okay, I would get a blood pressure cuff and check the blood pressure. I would get a pulse, radial pulse, and I would check that with the apical pulse. And then I would check the okay, I got the blood pressure, and then I want to do their pulses as well. Okay, so you want to do the radial pulse, and this is part of the cardio, but you want to do a carotid pulse on each, and then you want to do the pulses on the pedal pulse and the femoral pulse. And you also want to check for skin turgor while you're down there. And okay, so while I'm there, I'm going to go ahead and check before, because I don't want to palpate or anything. You would use a small bell, and you want to check for the valves. So you would do the pulmonic, the aortic, the pulmonic, the herbs, the tricuspid, and then the mitral. And you would check to make sure those are opening and closing. Okay, so everything's good, symmetrical. We're going to go ahead and do our neurology. So we're going to start back up at the head. The entire time I'm going to be doing these assessments, I'm going to check the skin assessment the entire time for any, for the color, the breakdown, the temperature, any bruising, skin capillary in the chest, anything like that. So For the neuro, I would take this light and you would dim the light, and you want to check for accommodation. So, and then also you want to check for pupil dilation. And if it was an older child, you would, you know, get it to follow, but the baby's not going to follow anything. Okay. So then you want to check the baby's mouth. If the baby isn't opening the mouth, usually they're crying by now. So you'll be able to see that, you know, they have the soft palate, that they have no cleft palate, that everything's good and pink. Nostril is not occluded. There's no drainage. The eyes are symmetrical. And the ears, you want to make sure there's no draining in there. And you also want to make sure that the ears are symmetrical, and you want to make sure that they're not above the eyes, because that would make them at risk for Down syndrome. Okay, so then you just want to make sure that you check the lymph nodes as well. So before I start down to the bottom of the body, I'm going to go ahead and check the baby's fontanelles. Hold on, let me get my stethoscope, because I'm going to check the lung sounds as well. Okay, so I'm going to sit the baby up, and I'm going to check the fontanelles, and you want to make sure that it's flat. If it's sunken in, then it means that the baby is dehydrated. If it's bulging, that can be a sign of shaken baby syndrome. Also for shaken baby syndrome, you want to check the eyes. They would look like they're blown, and they would look red. So everything looks good. So these, going back in my ears, and I'm going to check the lung sounds. Okay, and you want to check in 10 posterior spots. Okay, you also want to check for no bruising back there, which also would indicate some abuse as well. Okay, and then you want to do four lateral sides. Make sure that the breasts are clear. Okay, doing good, baby. And then you want to do the front. You want to do 10 as well, anterior. Make sure you go into the pattern that you're supposed to. This is a little bit bigger. Okay, you also want to check the quality of the respiration, and then we're done with that. So next we would go down to the GI system, and I'm going to listen to the bowel sounds first before I palpate. And you want to listen to all 4 quadrants, and you want to make sure that you listen for 1 minute. Until you hear the bowel sounds, and then if you can't hear them, you listen for 5 minutes. Okay. Okay. Ready to hear all the bowel sounds, and then after 5 minutes, if you couldn't hear them, you would notify a doctor. Okay. So I am gonna check the baby's belly, make sure it's not distended, check the contour of it, make sure that it's not hard, you know, that it's soft, it's not tender. I'm gonna lightly palpate, make sure it's not tender to touch, make sure you don't have no constipation. Ask the parents about the bowel movements, about any kind of diarrhea, constipation, and that's all for the bowels. Okay, then I'm going to wash my hands, and I'm going to put on my gloves. And I'm going to check the GU system, which is the urinary system. Well, if I can put my glove on. Okay, so I'm going to take off the diaper, and I'm going to check for any redness, any blood, any kind of diaper rash. I'm going to check, since this is a boy, I would check the scrotum as well as the foreskin, if it was not circumcised, if he was not circumcised. And I would check for any fissures, any hemorrhoids, just anything abnormal, redness, and then I would put the diaper back on. Note the color, smell, odor. You know, if they did urine, measure it. See if it's cloudy, stuff like that. So take off my gloves. Wash my hands. Okay, and then I'm gonna I've already done the legs. I'm gonna make sure that there's no edema in the legs. And I wanna make sure that I do all of the reflexes for babies, the Moro, the Babinski. Make sure the toes curl around the fingers. With an older adult, with an older child, you wanna just do range of motion. With someone with all of them, you wanna do the abduction and abduction, which is, for a baby, you would just kind of rotate those hips and make sure that there's no pain whenever you do that. And then with an older child, you would get them to do resistance and pull resistance and check that. Make sure they have 10 toes, 10 fingers, do capillary refills in all extremities. You would also do the whisper test, which you can't do on a baby because they're not going to understand. But if it was an adult or a child, then you would just occlude one ear and you would whisper 22 behind them and see if they can hear you. And then do it on the other side and say zebra and see if they can hear you. You would also check the perineal area if they were immobile to make sure that they have no skin breakdown. You would, let's see, I think we have pretty much got it for these babies. I checked all the reflexes, skin color, edema. I mean, it's a perfect baby. I did the pleura, did everything. So now that we're done, and I did the weight. Actually, I need to still weigh this baby. So I'm gonna take this. I'm gonna take this out before I did the measuring. I did not weigh it. So I'm gonna zero out the scale, place the baby down, make sure that you have your hand over it, and 7 pounds 6 ounces. Perfect. Document. Take the baby back, and then I'm gonna swaddle the baby because we're done with our assessment. All right. Okay. And then I would give the baby back to their mom if they wanted them. If she was sleeping, then I would just put them in a safe spot beside the mom. And then I would document and record after I washed my hands and check on them again soon. Skill done.